Hello again. Throughout your life, the active form of vitamin D, that calcitriol I mentioned in the last video, is tightly regulated by a hormone called PTH. That is, except during pregnancy, which is a unique time in your body. During pregnancy, the calcitriol levels rise 2 to 3-fold and is maintained throughout pregnancy. And this sharp increase in calcitriol levels are not seen throughout the rest of your life. And it's believed to not only support the pregnancy, but also developing baby. But the rate limiting step is how much vitamin D stores you have, that calcidiol that we measure in the blood. So this graph comes from a randomized control trial, which was published back in 2011 in the Journal of Bone and Mineral Research by Hollis and Wagner et al. And what they did, this randomized control trial in about 500 women, and they wanted to assess the safety and efficacy of supplementing vitamin D3 at higher levels, up to 4,000 IUs a day, with the goal of achieving a physiologic level of vitamin D in the blood, typically seen in people living in sun-rich environments such as the Maasai tribe that I mentioned in a prior video. And we learned a few different things from this control trial. One was that there were 0 adverse events supplementing pregnant women. So it was completely safe. 2, we also saw that most of the women did achieve a sufficient amount of vitamin D such that their blood level, the 25-OHD, was at least 40 nanograms per milliliter. And what they also showed was when a woman's level of vitamin D was at 40 nanograms per milliliter, there was a plateau effect, what we call zero-order kinetics, meaning that was the amount of vitamin D that triggered the maximum production of the calcitriol hormone, the active form of vitamin D3, at 40 nanograms per milliliter. So that's why it's vitally important for you to have enough vitamin D stores so that your body can make the active hormone form to support your pregnancy and developing baby. You need to know your number now, raise your number with supplementation and sun, and maintain your number. Target for a sufficient optimal amount of vitamin D is 40 nanograms per milliliter. I believe we should be vitamin D sufficient from the womb to the tomb.